With that, thank you. With that, Sneh, with due thanks to Jaina again, I will pass it on to you, Sneh, for the next part.
And thank you again, Jaina Federation and the president for helping us host us organize this, and then inform all the attendees. We can begin. So our first speaker is Dr. Ronald Trumairi, and so he's licensed and trained in general psychiatry at the University of Connecticut, and he has also done a fellowship in community psychiatry at UC San Diego. He is currently working for the San Diego County Psychiatric Hospital in their psychiatric emergency room. And we are just happy that he has volunteered to come on the seminar with us and helping us kind of make this whole organization run efficiently this time around, and helping us answer questions related to mental illness and other anxiety and depressive disorders. So Dr. Ronald Trumairi, let me share the PowerPoint slide so we can get started. Just if you, everyone can see the slides, correct? If you guys have any issues, you can type it in the chat, so then we can fix it. But everyone should be able to see these slides. Okay. Is Dr. Trumairi?
Ronak?
Is he he earlier he had problems with his Zoom. Let me
He's here. I can see him. Ronak, unmute yourself. No, you have to. Sneh, ask him to unmute himself.
Okay, let me.
Yeah.
Got it. Thank you.
Okay.
Sorry, I wasn't able to do it myself.
Okay, sorry. Yeah, let me change the settings real quick. It's good now, right?
Yes.
Okay. Let me pull up the slides again. Screen. Okay.
All right, I'll take over. Jajan and everyone, thank you for having me. Sneh, thank you for coordinating, and everyone else involved. Nathan Uncle, thank you as well. Like you mentioned, my name is Ronak. I'm a psychiatrist. I work here in San Diego. I've been working here for 3 or 4 years since I finished my training, and I'm generally working in within the government setting or the not-for-profit setting. And as Sneh mentioned, I'm currently working at our local county psychiatric hospital in the emergency room, where I see people that are coming from all walks of life, oftentimes uninsured, underinsured, homeless, and going through a lot of life circumstances, and usually in some form of crisis. The work I do really gives me a narrow sliver of their journey in life because it's an emergency room. But I see it as an opportunity for myself to really make an impact when someone's struggling and at a really vulnerable point. And I feel like that's where you can make a difference when they're ready to receive help and try and make some changes. Can you change slides? So today is actually a very opportune day to have this discussion or seminar. It's actually World Mental Health Day. And so with that in mind, I wanted to encourage everybody to take the opportunity today to find somebody they love, somebody they care about, and reach out to them. It could be a friend, a coworker, or a family member, someone you know who might have been struggling or was through this last year having a difficult time with everything the world has sent our way. It could be mentally, emotionally, physically, spiritually. But it's that human connection that really is a powerful vehicle for change, especially in mental health, where it's harder for somebody to do something themselves and where that extra helping hand can really make a difference. A big part of that World Mental Health Day is to decrease some of the stigma. And we'll talk about some diagnoses and treatment and have a discussion down the road to help everybody understand it's okay. It's okay if you're struggling. It's okay if you need to ask for help. It's no different than diabetes or high blood pressure. It's just harder to fully understand because each individual is so different, that their version of depression or anxiety might be different than the next person's. But if you can, try and reach out to somebody today that you know who could use the help. I've listed on this slide, and I'll have it again at the end, 2 really good organizations. I wholeheartedly support the first one. It's called Nami. It's a National Alliance on Mental Illness. It was founded by family members of individuals who suffered with mental illness. And they created support groups for caregivers, as well as the individuals who are experiencing their own struggles, and to better understand and meet other people in those communities that may be going through the same experiences and not know fully all of the things that come with this new journey if they are first diagnosed or newly diagnosed with a mental illness. There's lots of great resources, including local groups all throughout North America, including Canada, if we have any of our neighbors from the north here today. And the second one is SAMHSA. It's a government website. It's also good at connecting people with services, though a little more in the traditional setting of hospitals and clinics and recovery-oriented programs, but also really good resources. Today being World Mental Health Day, I thought I'd include that May is Mental Health Awareness Month. And if you see the green ribbon on the right, during the month of May, I'll be wearing a green ribbon. If you want to support people who have mental health, that's a great way to do that. That's what that green ribbon represents. All right, next slide. And so one thing that we talk about, we say mental health, and it can mean a lot of things very broadly. And I wanted to talk about what mental health can be. For most people, it can be something as simple as needing to make sure they unwind at the end of the day, or making sure they get a good night's sleep, or exercise, and that can improve their well-being. So mental wellness is something we are learning to talk more and more about, and talk about self-care and what things an individual needs. Through COVID, we saw that we lost a lot of human connection, that people felt more isolated, and they weren't able to go to the gym. The temples were closed. They were having a hard time getting groceries to be able to eat properly, or they're finding ways to make do, or they weren't able to get together with friends and have a good laugh. But these are all simple things that can be a part of any individual's wellness plan. However that may be, different people use different techniques, but it's up to you as an individual to really figure out what's part of your wellness routine. I can personally speak for myself. Through COVID, when gyms weren't allowed, I learned there's so many great places to go hiking and go outdoors and explore other ways of getting exercise. And that was one thing that I changed and found other ways of reinventing my wellness plan. So it didn't become feeling more isolated and alone, that I was able to get out in ways that felt safe given the circumstances, and fitting in line with some of the things we know with meditation or mindfulness, where you can exercise practices to help you feel more aware of your intentions and be able to make decisions with good intentions behind them. But the contrast between wellness and trying to make sure you live a quality life and that you're able to weather the struggles that life throws at you, the contrast is illness. And when it gets to a point where it starts to affect you, where you can't do the things you need to do. And that's really where my expertise comes in. As a psychiatrist, my role really becomes when someone's unable to take care of themselves, unable to do the things that they were normally doing, or suffering to a point where they they need help and they need somebody to step in and be able to help them. And that's where treating illness comes in. Next slide. And this is a very tricky conversation because we can't always identify where mental illness comes from. It's always complicated. It's never one thing. And there's always this conversation of nature versus nurture, if you've heard of that before. Nature meaning what you're born with, your genetics. If somebody has a family member with depression, there's a chance they can also have it. But is it because they've learned things from that person or that it was passed on genetically? And there are a lot of studies being done. Some mental illnesses have a higher chance of being passed on genetically. Some of them we're realizing there's so many different genes, it's no guarantee. The other argument is nurture and what happens with somebody as they develop, as they grow up. And nurture can be so many more things. And a really important point is women's health. If a woman is pregnant, her health directly connects to the child's health. We know that taking a simple vitamins can decrease the risk of neural tube defects and neurologic issues. And so taking care of your development before you're even born plays a huge role in how mental health can play out. After you're born, the first 5 years are very crucial. Those first 5 years are really when a child is learning the core understanding of how the world works and understanding how to interact with the world and the people in it. But it's not just those 5 years. Every human being, their brain's not done developing until they're in their mid-20s. So you have a lot of different things that will tie into. A lot of different things that'll tie into what can affect mental health. So it's never that clear. As people get older, we know medical illnesses can make it look like something that's mental health or substance use, or people at different stages in life can incur different traumas or situations, whether it's being unemployed or not having money or being isolated, like in COVID, or learning maladaptive behaviors. For some younger kids, it's how they use cell phones and they become pretty dependent on that and are less able to do the things they need to do. And it can create some level of unhealthy behaviors, or sometimes we just don't know. Next slide. So these are some of the broad categories of common mental illnesses I wanted to talk about today. Each one has its own spectrum. It's never the same for any one individual. It can be mild to very severe in each case. And as a psychiatrist, I may take a different role than a therapist or a social worker or a case manager, or even someone else in the community who's had the same experiences are there as a support, or a family member as a support. Next slide. So with those same categories, the two things that I really focus on are when somebody says that they have anxiety or they feel depressed or they've experienced something very traumatic. The two things for every single diagnosis is, are they in distress? Is it affecting them? Are they suffering? Or is it affecting their ability to function? For some people with, we'll go down the list, with trauma or PTSD. What someone may experience is they experience something very painful and traumatic. Oftentimes we think of violence or sexual abuse, and these things can come back in different ways. The extreme end of it would be post-traumatic stress disorder or PTSD, where someone might, without their willingness, relive those events, where they have flashbacks to living those events. Also, veterans coming back from warfare, they wake up in the middle of the night with nightmares thinking they're still on the battlefield. And then if they're in an environment that reminds them of that situation, they could lose touch with reality and think they're really there and have to relive those experiences. It can lead to changes in your mood when you're in that environment, or being avoidant of situations that might make you feel like you're there. And in extreme cases, you lose complete awareness of who you are, and you have a depersonalized sense of the world where you lose track of who you are in the world you're in. On the other side, trauma is something we all experience in different ways. It can help you grow, and it can help you learn from the world around you if it didn't sit that heavily with you that it became a stress disorder. And so where does my role come in is, first I would be doing diagnoses. If someone comes in and says they experienced something traumatic, I would understand how it's affecting them today, if it's a memory of something versus are they having symptoms that cause them a lot of distress and they're unable to function in their day-to-day routine. And that's where medications may play a role.
Ask you to help me.
That's where therapy may play a role, and working through the situations they're in. And different types of therapy and different types of medications will come in. I'm not going to touch on those details because it's different for each individual based off of medical issues and based off of
હવે કઈ plug નથી કરવાનું, ખાલી એક phone છે.
After trauma and PTSD, we have anxiety spectrum disorders, which are some of the most common diagnosed mental illnesses. And at times, we actually need anxiety. It lets us know if we were standing on the edge of a cliff, that flush of, I need to take a step back, something's a danger. Or if we think back to our ancestors, they were in a jungle and there might have been a tiger, that flash of anxiety would have told them, there's something wrong, I need to do something. And in those cases, it's not causing them any impairment in functioning. It's not causing them any distress. It's actually helping them. And that's why anxiety is actually a good thing. But when it becomes a problem, when it gets in your way, for some people, they worry excessively, where they can't stop thinking and worrying about the future of what might happen, or what if I do this, or what if this outcome happens. And it keeps them from being able to be comfortable, being able to make decisions, and it keeps them from being able to enjoy doing anything because they're so worried and consumed by what may be. And that's where medication may come in, therapy may come in, and talking about where it came from, whether it was something genetic, whether it was something that happened in different aspects of their life, or different types of therapy, which would be doing behavioral work to expose yourself to the things that make you feel nervous. For me personally, I could say public speaking is something I don't like. So doing this today helps me expose myself to being on a stage and working through that. So for me, it doesn't cause me to shut down. I'm able to talk through it and be here with you all today. For other people, they might not be able to be here and talk through their anxieties in that context. Other people could have more severe anxieties where they have panic attacks, where their whole body shuts down, their muscles get stiff, they break into a sweat, and they're not able to even leave the home in severe cases. And that word is called agoraphobia, where you're so overstricken by anxiety that you're afraid to leave the house because anything can go wrong. And that's where, again, my role would be finding out exactly what's going on, giving medications in the short term to help bring that intensity down so that they can leave the home. They can practice the therapy and behavioral work to get out into the world and teach their brain it's not as bad as you made it up in your mind. Other things that we all know, someone might have a fear of spiders. We call that arachnophobia, or a fear of snakes, or specific types of phobias. We all have something in some way that becomes an irrational fear. And it can be similar. Certain cases like that, you might not need medication. It could be therapy. It could be learning to go to a zoo and look at the animal you're afraid of, even though you know it's a safe environment. And that can help you work through that. Anxiety is a very complicated thing, but it's a good thing, and we need it to let us know when to worry. Related to anxiety can be OCD, which stands for Obsessive Compulsive Disorder, where people have behaviors linked to an uncomfortable feeling or anxiety. Then for some people, that could be cleaning. They can't leave the house without cleaning over and over again. And it takes up so much time that they can't leave the home. And if they don't do it, they're in that much distress and pain that I wasn't able to do what I set out to do. And now I have to do it all over again. I've had some patients who had to count a serial of numbers before they could take a bite of food. And if they didn't count and do the math the right way, they'd have to start all over. So just having dinner would take hours. And that would be one form of OCD. Other forms could be tic disorders, where people might have body movements or jerks that are uncontrollable, or words that they might say that have happened compulsively to alleviate some sense of underlying stress or anxiety or worry. That can also be hair pulling or hoarding, where people stockpile things in their home. If anyone's seen a show called Hoarders on TV, it's about people who have a compulsion or a very deep down need to save everything, and they're unable to get rid of anything, and it gets in their way. It's not being like me. I save my old grocery bags. They're not getting in my way, but I'm able to say, hey, they're there in case I need them, but I'm not saving the last 50 years of newspapers and old food or things that would get in my way of functioning, where my home is no longer a home. In that case, with OCD related disorders, the treatment would be no different than the other options or the other diagnoses, where there might be some medications involved, and there would be a lot of therapy involved, because to change that behavior, it takes a lot of effort, and not just on your own part, but having someone else help you through it. One thing I left out, my role as a psychiatrist, when it comes to trauma or PTSD, a big thing that I have to do is continue to screen for safety. If someone was in a home where their partner, husband or wife, was hurting them and beating them, and they come in saying they're scared for their life and they're worried what's going to happen, as a physician, it's my job to report to the authorities when there is domestic abuse, or if there's a sexual assault. I have to go to lengths to make sure people are protected. There have been times where elderly individuals or children are in a home and they can't advocate for themselves. If they come to my emergency room, I knowingly that this is a situation that is putting somebody's life at risk, I file adult protective services or child protective services reports, and I submit them to the government, and they do welfare checks, and they go in to ensure the safety of a home and an environment. And that way we are not allowing the trauma to continue and hurt somebody further down the road. That's one of my jobs beyond just treatment when it comes to trauma and PTSD. When it comes to eating disorders, I have a very different concern that goes beyond giving medications and trying to work with the therapists to help somebody have stable eating patterns and not, unfortunately, some people throw up their food or do things that cause them to have unhealthy patterns. And with eating disorders, unfortunately, that can change your chemistry in your blood, that can affect your bone density. And my big concern is people can have heart rhythm issues or seizures or a lot of fractures in their bones because their bone density is so impacted. So I would be doing lab work to make sure they're medically okay, or trying to coordinate with the medical doctors. Beyond that, like any other primary care physician, as if this was blood pressure or diabetes or arthritis, there's medications involved to decrease the symptoms, to decrease the severity, and hopefully some lifestyle changes, whether that's back to a good wellness routine, making sure you're in a good environment that's not worsening what you're experiencing. Now, these last few, the mood disorders, so depression and bipolar disorder, are two very different things, but we use the word depression a lot. And the way that we think of it is someone is feeling sad. That could be on the very earlier ends, or the not a clinical depression that I would give medication for. Maybe they need somebody to talk to. Maybe they need to go for a walk. Maybe they need to get a good night's sleep, and it could go away the next day. But if that feeling doesn't go away, then it can grow into something more. With depression, we don't just talk about the feeling of feeling sad or depressed, but where medications might come into play or therapy might come into play is when it gets worse and worse to where it, again, starts affecting a person's ability to function. It might cause them a lot of internal struggle and suffering where they lose the ability to enjoy life. They lose the motivation to get out of bed, to do anything. They lose energy. They can't focus or concentrate. Somebody struggling with major depressive disorder, a true depression, they might lose their appetite, or a variation of depression, they can't stop eating. And sleep can go both ways too. Somebody can't stop sleeping, but they always feel tired, or the opposite. Their sleep is so broken that they never feel like they've rested because their mind is just busy and consumed, constantly waking up, whether or not there's something like anxiety on their mind they're worrying about. That it's naturally the chemistry in your brain is saying there's something wrong. It's not keeping the right balance to allow you to get a full night's rest. Depression also comes with one big thing that I worry about is suicide. And we don't talk about it. There are enough people in every community that have taken their life by suicide. And that's something we take seriously. So myself working in an emergency room, there are people who come in because they called a suicide hotline, or they told their girlfriend that, hey, I'm feeling this way. And so that person calls 911 and says, we need help. We need to get this person to an emergency room. I don't want them to take their own life. And that is the absolute first step. If someone's feeling that way and not connected with any help, they don't have a therapist or a psychiatrist, or they don't have a close relationship with their primary care doctor, it's okay to turn it into an emergency, because the alternative is something we don't even want to consider. So those two websites I listed earlier, Nami and SAMHSA, they'll both have suicide hotlines. Every city or major city, county has their own local ones that coordinate with law enforcement. And if you know somebody's feeling that way, it's always good to help them get connected with services. With or without insurance, that's something the government has ways of helping and facilitating. As far as depression, when I wrote on the wellness plan, I listed a few things, and I made a few things that were bolded, and exercise was one of them. And surprisingly, there's really good scientific evidence that exercise can actually help depression, at times even better than some medications can. And a good diet, good nutrition of what you put into your body can also affect the way you feel and think. And from a Jain perspective, we think of that at times where we say don't have root vegetables because it can affect how you think and feel. No different than other dietary restrictions we put on ourselves because we understand the ways that what we put into our body can affect what our body does and how it functions. Now, depression is when somebody is lower than they normally are. A bipolar depression or bipolar disorder comes with two parts. There are times where they feel low, where they don't feel like they have motivation, they don't have energy, they might not have an appetite, they might have thoughts about hurting themselves, or hopeless, or they lose interest in things. Or the opposite can happen, where they have so much energy and so many grand ideas that they think they can cure world hunger or cure climate change, or they are going to be best friends with the president, and they're getting ready to buy a ticket and go run across the country without thinking or planning, because they have so much energy and so much enthusiasm for their ideas that it gets in their way. And that's the big key. When does my field intervene? And when there's some level of impairment in functioning. If somebody is booking a plane ticket to go meet the president and they have grand ideas to change the world, that's not going to be easy for them to accomplish. And unfortunately, at times in the emergency room, we also get people who say they're going to hurt other people when they have these grand ideas. And we have to file reports to make sure other people are safe. I've had to file what's called a TerraSoft report many times to make sure that the people that were potential victims get protected. I have to file reports with law enforcement to make sure they're aware that this person's making these sorts of threats. And bipolar disorder can come with this grand sense of existence, but it doesn't last forever. And that's what's concerning. It may last 3 to 4 days and it won't be as severe, or it can last a week or possibly longer. And then it can get messier and more difficult to treat. And bipolar disorder, it was once called bipolar depression, is very different from depression in terms of what's happening in the brain. It's about 1% of the population suffers from a true bipolar disorder. And there's so as far as the question that was posted, does bipolar disorder lead to a manic disorder? There is no such thing as a manic disorder, but within a bipolar disorder, there's a manic episode when somebody has those grand ideas where they're not sleeping, have more energy, potentially losing weight, engaging in risky behavior, whether it was driving recklessly, it could be very other forms of risky behavior, whether it's drugs, sex, putting yourself in dangerous environments. And those manic episodes are the highs of bipolar disorder. The same way there are the lows of depression within a bipolar disorder. But what's happening inside of your brain in a bipolar disorder is very different than what's happening in a traditional major depressive disorder. And within that bipolar disorder, what we find is that there is a part of your brain that could be falling apart or breaking, and it's causing some degeneration of your brain. Similar to the next category called schizophrenia, where that's also happening. It was originally called dementia praecox, which means early onset dementia, because what was happening is people looked like they were having dementia. And so that's why it's so important when someone is having one of these episodes to get treatment as soon as possible. Because the longer you wait, the worse it can get, the more permanent it can get. And at that point, it becomes harder to treat. It means that person's quality of life can go down. And so early treatment for any of these, whether it's a teenager who's struggling with depression or anxiety, it could mean all they need is somebody to talk to, a therapist or a counselor, or somebody who's having a major depressive episode where they're having thoughts about hurting themselves. That also, the earlier you have an intervention, the less likely it is to come back, the less severe you allow it to get. And with that, I'll share a quote that I really like. It's, "Man's mind, once stretched by new ideas, never regains its original dimensions." So the longer you allow something to happen, the more severe it gets, and the more likely it gets to that level of severity or worse again, or the next time. Depression, when someone says they feel depressed, a part of my job is helping tease apart between a depression or a bipolar disorder that has a depression as well as those manic episodes, those highs and lows. And based off of that, the wrong type of medication could actually make a bipolar disorder worse. What I would give to somebody who has a regular depression could actually make bipolar disorder worse. And we have to really pick different medications. And that only happens if you get a good history, get a good understanding of who this person is and what's led them to where they are in that moment. I mentioned earlier that bipolar disorder has some similarities to schizophrenia because there is some degeneration happening in the brain where we see parts of your brain are dying. And in schizophrenia, we've seen this in some studies where the different neurons that communicate to each other in your brain, they have more than one connection. Think of it like an octopus with 8 different arms, but hundreds and hundreds of them. It loses some of those arms and it can't communicate as well to other parts of your brain. what happens in schizophrenia is there are three major aspects of it. One is positive symptoms, which when you think of positive symptoms, you think of things that are extra positive. So someone might be hearing voices or experiencing things that aren't happening to other people. Needless to say, that causes a lot of distress and it really affects their ability to function. And that is one of the diagnoses that's very hard to treat. Mansi, I saw your question. I wasn't able to read it before it went away. If you could post it again in 2 minutes, I'll keep an eye for it. What happens in schizophrenia, like I mentioned, there are three aspects. Those positive symptoms. I'll come back to that. Oh, Manish, sorry. I'll come back to that. What happens with those things that are extra, those positive symptoms, they become very obvious when one person is sitting here saying, do you hear that? They're talking to me, they're judging me, something's happening, they're coming after me. And it then can become paranoia that they think these voices are coming after them, or it could be completely positive. And I've had a patient who thought he could talk to the weather. And so today he would see the clouds and he thought the clouds were telling him it's going to be cloudy today. And he had a conversation with the clouds. So it was harmless in that situation. And that person didn't want to take medications, but they never became distressed or weren't able to function. They just could talk to the clouds and they believed they had a relationship with the clouds. But I've had people who thought the FBI was coming after them and they could hear the FBI talking to them. And that's the positive symptoms of schizophrenia. The negative symptoms of schizophrenia would be someone who has no emotional reaction, someone who has no energy. They lose the will to socialize like human beings. Unfortunately, that's one of the harder parts of schizophrenia. We don't have medications to treat that. A lot of that is trying to encourage that person to interact and find a community, find a situation where they want to go, want to interact. And it might be limited. It might be very specific to that individual. You can't say, go to Jane Center, everybody's there, you'll be okay. They might say, I only want to go to the library. And that might be the only place that works for them. And you really have to work with that individual because there's going to be a limited amount of things that will work for that individual. Like I mentioned earlier, schizophrenia was originally called dementia praecox, which is early onset dementia. And the third aspect, you have those positive symptoms of schizophrenia where there's something extra that was not there. You have those negative symptoms of schizophrenia where something is missing that used to be there. So that could be socialization or an emotional reaction. And then the third is cognitive impairments. So sometimes there might be inability to do math or inability to learn new things as easily because unfortunately parts of the brain are, they call it synaptic pruning, where parts of those projections in your nerves in your brain aren't communicating anymore. So it's harder for the brain to do its job. And that's one of the most disheartening diagnoses or people with that diagnosis to see because it is a very drastic change. So Manish, your question, I don't know if it was around rejection of this diagnosis. How do you deal with somebody who's rejecting this diagnosis? If you meant it in that context, the best thing I would say is take them to one of those meetings. I listed that website, Nami, and you can take them and there will be other people who've been through where they're at in this journey and they're on the other side. They've learned to accept it. They've learned their own individual perspective on their version of schizophrenia, whether it's voices they hear or they believe that the clouds are talking to them, that those are delusions where you believe things that are not true. And they learn this is who I am, this is a part of who I am, and how to live and function with it. And that medication, it may not be easy to say it's going to help you not hear those voices because to them, they're very real. But you can teach them that this medication might help you suffer less because that's also happening when the voices are so overbearing that the real world gets muted and turned down because the ones they hear that nobody else can that's how do I see the questions?
If you go in the chat, there should be
There was only one, Ronald, that I can tell you.
I missed the last one. Yeah.
How do you explain a person how to deal with rejections?
Rejections in terms of emotional rejection.
I will let the person explain. This is by.
Oh, I meant in the context of rejection from family members.
I see. And it depends what the underlying concern is. If they're rejecting people around them and rejecting all of the family members, a lot of it is, if it's in the context of schizophrenia, or even depression, it's trying to help them get treatment and get medicated. Calling 911 if it's getting severe enough to where they're a danger to themselves, if they're a danger to other people, or if they're unable to function or take care of themselves. If it gets that severe, getting them treated to where then you can actually have a dialogue. And that's where my role really comes in. I don't do therapy. I mean, sort of, but I'm not a therapist. I'm not going to be doing social work or case management or setting up things. What I will do is I will give people medications to where they have a little bit more clarity. And possibly if they're in a hospital, you can have a family intervention where you can sit down. And the most difficult part about mental illness is it doesn't get fixed overnight. There is no quick pill that will make your blood pressure stabilize or your blood sugar balance out the way insulin might or metformin might. This is going to be a long process because our consciousness and everything that we are comes from our minds. So when there's something not aligned ideally, it takes a lot of energy and a lot of love and a lot of support for that person to understand. And maybe it comes from somebody who's outside of the family, trying to encourage them to go to therapy or go to those group meetings through Nami, which I like I mentioned. And finding other support systems where they feel whole, so that they can then go out and then re-engage with the family because they have some other anchor in their life where they feel they can connect and be understood. And the hardest part about family is you're there to care and take care of somebody. And when you see them struggling, you want to help and you want to change, and they're not ready to make those changes. And so you get that friction, you get that rejection where they're not ready to do the things you say, whether it's because of what's happening in the moment or years leading up to it. It's a very complicated dynamic when it's family. And the hope is, with the right amount of treatment, that person's able to think a little bit clearly and at least see that they're in a better situation with a little bit more help. Could there be a person that has both schizophrenia as well as bipolar disorder? Yes. There's a different diagnosis that I didn't list called schizoaffective disorder with a sub-bipolar type. And that is where somebody has a lot of perceptual disturbances, so auditory hallucinations or other types of hallucinations, but they might also have a mood component that changes their mood as well. And it can be the lows of depression or the highs of mania. And so, yes, but it would be a different diagnosis called schizoaffective disorder with a comma and then bipolar type, where they have the psychosis component of schizophrenia. And then they also have the mood fluctuations. If it's bipolar, then you have both the lows of depression and the highs of mania. And those could happen at different times. They can happen at the same time. But the underlying thing is that psychosis might still be there, that it's not just happening when those highs of mania are happening or the lows of depression are. That you would see the psychosis stick around regardless of the mood fluctuations. Those are two of my toughest and most disheartening diagnoses to work with, schizophrenia and bipolar disorder, because it is not easy on families. It is not easy on the people around those individuals. And it can be tricky because they're not ready to understand that this is a part of their mind and a mental illness. And that takes time. It can take years. It can take trial and error with medications. One big thing everyone should know, whether it's for anxiety, whether it's for trauma, whether it's for depression or any of these diagnoses, the medications I prescribe or any psychiatrist prescribes will not have immediate effects. And the dose you start at may not be the dose that actually helps you. But to minimize your risk of side effects and not liking the medication, you have to start at a low dose. You might need to change the dose. You might need to work to where it's getting the results you want, but it won't be a quick fix. There's a lot of patience, a lot of trial and error, and a lot of working through things on a long timeline. That's where a lot of these medications come in. They're not ideal. They come with side effects, and our brain is the last frontier of medicine. We haven't figured it out. It's the organ we know the least. So a lot of the medications we have are less than ideal because medications don't get into your brain the same way infections are less likely to get into your brain. So the brain is very protected. Is there a holistic way of avoiding medications? What I will say, if somebody is in a severe enough situation where they are unable to function or they're in so much distress, then you have to go down the allopathic, the traditional medical route. This is my opinion. I am a physician. I don't study Ayurvedic or holistic care, so I couldn't tell you what things work there. For mood and anxiety, yes, definitely. There are holistic options. There are wellness lifestyle changes you can do, diet, exercise, sleep routines, lots and lots of things you can do for mood, anxiety, for depression. But when it comes to something like schizophrenia or a bipolar disorder, I would say no. Holistic care is not strong enough because those are much severe, much more complicated illnesses based off what's happening inside the actual brain. But holistic options for anxiety, for mood, when it's milder, when the person's still able to function. Yes, meditations, yoga classes, that is great for milder situation. When it's severe enough, that's a great thing to balance out medications. And the long-term goal should be, if you're only starting medications for the first time, to eventually, after a period of 3 to 6 months, say, can I get on a lower dose? And can I get on an even lower dose? And you wait weeks, maybe a month, maybe multiple months before you lower the dose again and say, how am I doing with these lifestyle changes, with yoga, with meditation, with better diet, with better sleep routines, with better social networks and more positivity in your life to uplift yourself in as many ways as you can to be on less and less medication. And if you do well, great. But if it comes back, you might need to get back on that medication if all these other things aren't working. And if it comes back multiple times in your life, it might be a sign that you might need to stay on a medication a little bit longer and test it out until you're in a better place if there are situations affecting it or medical things or other contributing factors that you can work through. The last thing on the list of diagnoses I have is substance abuse and addiction. And in the world we live in, there's this growing need for people to have immediately what they want. And I see some of these younger generations. I'm not on social media, but I see some kids who pull out their phone and they're instantly taking pictures of everything they eat and posting immediately and looking for reactions and likes and everything. And so substance abuse and addiction is on the rise. As we decriminalize certain drugs and as we see a lot of people who are struggling through isolation through COVID and people who don't have jobs and rising rent prices and the world is changing to where we see people going more and more down the route of substance abuse. Here in San Diego, I know alcohol and marijuana, because it's California, are very common. Methamphetamines was a drug that was very, very common. But now I'm starting to see heroin on the rise. And that is very scary. Heroin and fentanyl on the rise here in San Diego and greater Southern California. I'd assume it's migrating this way. The Northeast, where I did some of my training, heroin was rampant and I knew how to manage it there. Here, I'm seeing people who are doing multiple drugs and it's getting worse and worse. So I have people who come in who are starting to fall asleep and getting drowsy, and I have to give them a shot that undoes that heroin in their body to wake them up immediately and put them in immediate withdrawals. And then I have to take care of them after they're immediately withdrawing from heroin, because I don't want them to stop breathing in my emergency room. I would much rather make them feel uncomfortable and take care of them than to get them to allow them to continue to stay under the influence and then stop breathing because of it. But it's getting worse. And we don't have the right resources in our communities to treat it effectively. And a lot of it revolves around love and connection and supporting each other. So someone doesn't feel like they need to escape reality and run away. But when it's far enough along, it's much harder to treat. It's much harder to get to a point where somebody is able to see their patterns and break them. That's where rehab comes in, where somebody's in a locked facility where they can't go use, and it forces them to break their habits and patterns. That's a big part of when people smoke cigarettes. How do you break that pattern? Because it's one of the more addictive drugs is nicotine. And I have, unfortunately, less so. It's a community-driven emergency room. So I don't necessarily see as many Indian people. I think we are very, very fortunate. We're very privileged in America. I think we have the Indian individuals have the highest per capita wealth in the US. And so I see less people in my emergency room, maybe one or two for a while. I don't. Yeah. So I don't see as many Indian people in where I am, but there are definitely people in the community who struggle all around, and we don't talk about it. That's a big concern as well. And there are people who are afraid to say, I'm struggling, I need help. I have, whether it's depression or anxiety or substance abuse, whether it's alcohol or cigarettes or something else. There are people who could very easily say, it's gotten out of control and I need help. Sneh, thank you for mentioning, Broward County, if it's increasing there too. It's concerning because more people are likely to overdose and die from something like heroin or fentanyl. That's my big fear with substance abuse and addiction. And as it's finding its way into Southern California, that's going to be increasingly of a concern. I have seen some people who are, not everybody's ready because it's a vicious cycle to exit that. It is currently live and it is being recorded. So I have seen some people through the human trafficking network. When I was doing my fellowship, I worked in a walk-in clinic and a crisis house. And so I did get some people who were trying to break that cycle of human trafficking. And I had a colleague who worked in that specific environment with human trafficking. And she was trying to help women who were coming out of that vicious cycle. And it takes a lot of time, a lot of deconditioning to relearn that the world is not that world. But that's a lot of therapy, a lot of supportive environments, and a lot of work that I don't necessarily see in an emergency room. Let's go on to the next slide. So what happens in terms of treatment for every single one of those diagnoses? What happens? Well, my first step is always education. I want people to understand what they're experiencing, give it a name so that they can go home and Google it if they want to, and make it real, make it personal, make it theirs. My role, if it's coming to me, medications may always, there's always room for it, whether it's short-term or long-term. Some people are in a better place where they're ready for therapy. Sometimes people need medications before they're ready to do therapy, because therapy can be, it can be a little destabilizing because it forces you to look at your patterns, look at yourself, look at the things that shape who you are, and tease that apart and put yourself back together in a healthier, better way. So you might need medications to hold you together through that process while you reevaluate your existence and life, because it's affected you to that degree. I wrote down treatment as peer support and community support when we're talking about individuals who suffer from schizophrenia or bipolar disorder, even depression, and they're learning what they're experiencing and how other people might have gone through it. That peer support, community support through that organization, Nami, they have all sorts of caregiver or family member run groups where it's directed at helping you as a caregiver for somebody who's suffering, or the person themselves if they're ready to go and listen to other people who are also suffering, or who have been through their level of suffering and they found a level of stability. On the last slide, when I was talking about addiction, that's like the 12-step program, if you've heard of that before, where people go to groups and meetings and they have help from somebody who's X number of years sober, and then they teach them the very specific 12 steps to get to that same level of sobriety. Sneh, you can go back to the one more forward. I've written love and social supports in here multiple times because mental illness is a very isolating thing. If somebody is not within the frame of reality, or they're so depressed that they can't socialize or they can't enjoy anything, it's a very isolating thing, and love conquers everything. Maybe with a little bit of other help when it's severe enough, but that is something we need to employ more. So someone who's there to show you it's going to be okay. I'll hold your hand and get you to that appointment. You don't have to do it yourself. And someone to make you not feel alone, because that is a huge risk when it comes to suicide. If someone truly feels alone in the world, that no one's there, that becomes a huge risk factor. And so knowing that you have people in your life, supports, community, we're very fortunate to have what we have within the Jane community, because at least the one I grew up in Southern California, I know hundreds of people that I can reach out to and say, hey, if you have a minute, I wanted to talk. But that's something not everybody has the luxury of. And so if you know somebody who's suffering, they're the ones who are suffering more than you. So if you can take a little bit of time to reach out to them. And for those of you that joined a little bit later, today is World Mental Health Day, which is the entire world celebrates mental health awareness today, awareness, advocacy, and education. So if you know somebody who's suffering, today is a good day to pause for a minute and reach out to them. Try and take a minute and just say, hey, I love you, I support you, what do you need? Or just hello, and I'm thinking about you. It takes very little from you, but it can mean a lot to that person who's going through more. Next slide. The next couple slides are just some statistics I wanted to include that kind of give a picture of where mental health is in the world. And I'll read them out and we can just kind of work through each one. I won't give too much detail beyond that, but almost half of Americans will experience an episode of mental illness in their lifetime. 1 in 5 people, 20% of Americans, suffer from a mental illness currently. And of those 20% of Americans, 6 out of 10 with an illness don't get treatment. The number one diagnosed thing is an anxiety disorder, which I think is a good thing. I mean, we need our anxiety. When we were living in a jungle or on farmlands and there were lions and tigers and snakes and things, we needed that anxiety to tell us, worry about something, bad things could happen if that snake bites you. But now we start to worry about what's going to be posted on Facebook or what is going to happen in politics, something you have no control over. And that anxiety cycles and it continues because you couldn't do anything. When that snake is there, you can run away. You can try and fight it. You can run away. You can do something and work through it to know you were safe in the end. And now our anxieties consume us because we don't have control over what happens next. And we know so much about the world that it leads us to being in tricky situations where we can't control the big picture because there's so many moving parts to make our global community connected that we might not be able to control the parts that we don't like. The next bullet point, suicide, the 10th leading cause of death in the United States. It's the second leading cause for death for ages 44 and under, 5th leading cause for 45 to 54. Men are 4 times more likely to die by suicide. So when they do try, it's more lethal. But women are three times more likely to try than men. So when they do, it might not kill them, but it's really saying, I'm suffering and I need help. Worldwide, 800 million people suffer from a mental illness, and 322 million people live with depression. One bullet point, I was looking for some statistics related to COVID, but suicide rates didn't actually change. We thought they might, but we do know that different socioeconomic groups suffer differently. But overall, in the population as a whole for the United States, the rate of suicide didn't actually change. I couldn't find data on individual population groups, but we know that some communities were harder hit than others. Next slide. I know this topic was partly picked by some of the younger crowd, so I brought in some statistics related to college and teenagers. But before the pandemic, 67% of college kids felt suicidal. They reported telling a friend rather than going to an authority figure or someone who could actually help them. 25% of college students have been diagnosed by a professional with some form of a mental illness. 34.2% of students with a mental health condition said their college didn't know about what was going on in their life. And 64% of students are no longer pursuing their college degrees because of mental illness. That number seems large. It might be 64% of those with mental illness, not 64% of all students. And then the younger crowd, teenagers, adolescent dies from suicide every 100 minutes. Third leading cause of death, 15 to 24. 12.8% of adolescents, teenagers, early 20s experience at least one episode of depression. Teens with depression have increased by 59% since 2007. And those who do suffer from depression have 30% chance of developing a drug-related problem later in life. Next slide. So for anybody, this is kind of where I talk about what happens next. And this is where I'm optimistic, because I believe that it's a journey. Life throws all sorts of different things at you, and you can turn a new page. You can see that the road continues if you're willing to continue marching down it. So what happens if you've been diagnosed with a mental illness? We are fortunate, we are blessed. We live in a time where there are resources, whether, do I think what due to cultural differences? But I think we're, Nem, I don't understand the question. Could you clarify? Oh, and so that is the US population as a whole. I don't know the individual cultural differences. And I couldn't find data on it to that degree. I know it exists with at least white, Hispanic, African American. I know some of those population groups have more robust data than our demographics. But that was general US population as a whole. Coming back to this slide of what comes after you've been diagnosed with a mental illness, it's a journey, like everybody's life. It's not about the outcome. It's about every day waking up and taking that journey and doing what you can with it. And so if it means you have to wake up and take a medication every day, or you have to wake up and make sure you take a few minutes to meditate or do yoga, or sun salute in the morning to help yourself feel more uplifted, great. That could be a part of your journey. And that's what helps you feel whole and feel good to continue your day. Great. And that's where I'm optimistic. There will always be people who aren't ready. Sneh, I want to come back to that because I have an opinion. I don't know if it's accurate.
Yeah. like I keep hearing,
But
now I keep hearing it. A lot of people have talked about this, and this is like I really wanted to ask this to like a professional to see what their
yeah,
take is on this.
yeah, you know, and I'll segue to that. So Sneha's question was, why do some countries with a lower socioeconomic status report higher or lower levels of mental health, mental illness, and higher levels of satisfaction, happiness? Um, and my take on it is really there are with the population I work with, there's a lot of homeless individuals. There are people who are chronically living a life that I assume neither you nor I would be comfortable with, but they've become very comfortable with that. I see some when I've gone to India. I've seen people who live in very dire circumstances, in like the small jhupparpatti or whatever they're called, the small little um, homes built on the side of the road, and that's what they know. There isn't much lower to go, and I don't mean this in a judgmental or negative way, but their fall from grace isn't the same as the person who had a butler, had a maid, had everything given to them, and then they have to go live on the streets. Or it's much easier to feel that disparity or that difference when all you know is really, really good. Anything less of that feels not good. And that's why one thing we do during Paryushan is to give up our worldly attachments. And that helps us recenter our perspective on what we truly need in life, right? And so my take on this is why in this advanced, greatest country in the world, do we have such a high level of mental health and mental illness? Well, there is this nature or this undercurrent of everyone's rights versus their responsibilities to themselves and to other people. And those rights kind of set you up to say, it's about me and what I'm getting out of this situation. And it sets you up to have demands and needs that might not be met all the time. Whereas if you're living on the side of the street, your main goal that day is, am I going to eat today? And most days you might find something to eat and your belly is full and you'll get a good night's rest. And that's all you need to be happy. There's a philosopher by the name of Maslow. He has Maslow's hierarchy of needs. And that ties in, right? If you have your basic needs met, you want more and more. But if all you know is that more and more, you have never lived without those other things. So why I really appreciate what we do during Paryushan, why Catholic people do it during Lent, why there's a Sabbath for people of the Jewish faith, where you take a moment to stop and appreciate the attachments and the things you have. That a lot of world religions and cultures have this same mentality of, let me take a break from all of these things that I consume more than I need to reset my understanding of what I actually need. Does that kind of answer your question?
Yeah, I think, yeah, because I've always wondered.
Okay.
Like I also had like just another like follow-up question. There is a difference between like let's say like physical stress versus mental stress. People are more willing to take on physical stress. They might be more used to that, but when there's a mental burden, it's actually harder to live with.
I agree. What was the question?
Yeah, so my question was is that like more of like a definition for like maybe like lower socioeconomic status countries or regions where they have to do more manual labor, but they don't have a lot of mental stress that goes with it.
Yeah, I can see that.
Okay, so.
Yeah, where it's a simpler, Lauren, I like that thought too, because purpose is something I wrote on one of those slides of what do you do in recovery and during treatment. Exactly. It's having purpose is a very, yeah. Having purpose is a very important aspect to existence, is a reason to get up, a reason to do something, whether it's taking care of your plants or cooking a meal for yourself. You have a reason to get up and do something that is motivation enough. Yeah. Next slide. So this is kind of the two big resources I put out earlier on. anybody you know who might need some help. These are two great resources. Nami is one that I support regularly, and I really encourage people, go on both of these websites if you want to learn more. They have videos, they have resources. You can go, almost every major city in the United States has local groups. If you wanted to go to a support meeting, or you wanted to go meet people who are struggling with a mental illness and hear their story, you can actually go to some of these meetings and understand firsthand what schizophrenia or what a bipolar disorder is like, or that person's version of it. Or you can go to a support group if you are a caregiver. If you are a caregiver for somebody suffering, whether it's physical or mental health, yes, I've done a few of the NAMI walks. Pre-COVID, they happen once a year down here in San Diego. It's exceptional organization that is started by family members of people who are suffering from mental illness to create a community of support for the people who are helping the people who are suffering with mental illness, so that everybody is taken care of in some way. And that's where the community takes care of each other. And SAMHSA is a government website that has lots of resources. If you know somebody who needs a provider, who needs to get connected with therapy or medications or recovery, if it's substance abuse treatment, that website will have a lot of resources there. And reach out to somebody. Today is National Mental Health Day, or World Mental Health Day. Reach out to somebody, even if they don't have a mental health issue, somebody who you just want to say hello to, because that human connection is what we have, in the community we build around it is what we keep. Any questions? Thank you. Thank you, Nir.
Yeah, thank you. Thank you so much for that presentation. That was really wonderful. A lot of meaningful dialogues and conversations also throughout. It was eye-opening. Yeah, Dr. Nathan.
Thank you very much, Ronak. And just for everybody's knowledge, we had somebody else signed up weeks and months ago, and person had some challenge. So we literally recruited Dr. Ronald Trumairi in 2 weeks' notice. And as he said, he's not a public speaker and camera shy person, but you did a wonderful job. Thank you very much, Ronak. Appreciate it.
Yeah, thank you.
And we certainly went along with all the answers as we went, whatever questions came on the chat. We hope that he will hang around till we finish. So if you come up with something else, please bring that question as well. I just have 2 comments to make before we move to the next segment. If you know people who can benefit for these talks, we have 3 other Sundays. We have done our best to recruit professionals and more in a relatively younger age group to associate more with youth. Not that my age group don't have any problem, but we were to certainly made it quite far, and probably we will survive to move on. But some of the younger people, they do have some difficulty. So if you can recruit people to come and join, we will certainly appreciate it. So please, and it's a social stigma, so it is difficult. But listening, coming, hearing certainly can help. And the second part, we do want to have a story teller every time. So we're looking for 3 other storytellers about personal experiences, either themselves, their family members. You do not have to identify. You can be off video. Don't give names, whichever way you feel, but it will be nice. Our idea is to share a personal story of what someone went through. And even if the end is bad to your friend or family member, it is okay. We would like to hear. So if you have, please email us. We will love to hear a story as well. With that, back to you, Sneh, and we should do the next part.
Okay, yeah. So
There was one more question. Mina had a question before we segue.
Yeah,
Um,
go ahead.
Yeah, Mina, as far as your question about the dichotomy of intruding privacy when trying to help, that is a very tricky thing. And I would say if somebody is suffering to the point where they are not able to take care of themselves, not able to provide food, shelter, or hygiene for themselves, that's something where you can intrude to the point of getting them to a hospital, to where they can get treatment to be able to then dialogue with them. If you are truly worried someone's a danger to themselves, intrude. If you know enough information to say, I'm worried about this, we don't want to lose anybody. And that's so if you know, however you know, it's okay to say, I want a welfare check. Please go check in on this person because this is what's happening. You don't have to personally get involved. You can get the authorities involved. We have PERT teams, psychiatric emergency teams that go out to a home to do psychiatric evaluations in home. So it's not a police officer trying to do that. That is someone who's trained in mental health to go out. But intruding privacy when trying to help if someone doesn't want help, unfortunately, you have to give them time. Time is the key, and hope you can let them know that you'll be there when they are ready, and just show them that you'll be there when the time is right. You're welcome. Sorry, Sinead.
yeah, thank you again for that wonderful presentation and answering the questions that all the attendees and participants had. So we're going to segue into the next part of the session. Dr. Varun Gandhi has a mental health story that he would like to share. He's been part of GCO and also has been helping us and working with us for the past year and a half. So yeah, I'll transition towards him and let him take the platform.
Thank you, Sneh. Thank you, Dr. Javeri. You did an amazing job. Even though at the beginning you said you weren't comfortable speaking in front of a screen, you did amazing. So thank you so much for the presentation, and I definitely learned a lot. So I wanted to, part of what Dr. Shah said, that we want to have stories as part of every mental health lecture. After I'm done sharing my story, if there's someone in the crowd that's currently there right now would like to share their story, please feel free to raise your hand, and we can also invite you on the platform to share your story. But I'll start with myself. So this was about 10 years ago, and I had this amazing girlfriend, and we were dating for a year and a half. And in my mind, I had solidified that she was the one, and I was going to move forward with her. And within 2 months, everything came down crashing. So after going through all of that, I went through a lot of changes in my mental state. From this presentation, I learned that I had PTSD as well. I'd wake up in the morning with dreams of being in that relationship, but then I'd wake up to reality that I wasn't. I'd wake up crying. It would be a very sad sight the first 6 months or so. So yeah, PTSD, then along with that, there was loss of motivation. I didn't feel like getting out of bed, the loss of appetite, being lonely, keeping to myself. Every 2-3 weeks, I'd meet up with friends, but otherwise I'd be all by myself. So that was kind of the start of my mental health journey, although I probably say it started when I was born with all the trauma and everything that came from my early ages of my life. But I finally realized that all of this had built up when I went through this particular incident in my life. And so the thing that helped me was, after I went through, you could call it depression, but I wasn't really diagnosed like clinically depressed. It was just, sadness, kind of like what Dr. Javeri mentioned in this presentation. I would say I was depressed, but I wouldn't really tell anyone else that I'm depressed right now, because I wanted to, I didn't really want to hold on to a title of depression, because then I'd be stuck with that. I wanted to move past that. So I knew I was depressed, but I didn't call it that at that time. At that time, then I came across this book by Dr. Deepak Chopra called The Book of Secrets. And even though I didn't understand anything in that book, maybe the first 2 pages is all I understood, but he dove really deep into philosophy, into understanding life as an overall. So that kind of started my exploration into spirituality, into diving deeper and understanding what life is all about. So as I was doing that, I went to Google. I heard about meditation. So I typed in Google, what is meditation? And from realizing what meditation was, implementing meditation in my life, that started changing things for me. But it was a slow change, as Dr. Javeri mentions. It takes a lot of time. So meditation, then once I picked up meditation, then I realized, nutrition goes along with it. What I feed into my body affects my mood, affects my mental health. And it's a whole picture. So I started changing my nutrition towards a healthier food. I became vegan about 5 years ago. And all of this played a role in my mental health journey. Other things that helped was going on daily walks, exercising as one thing that Dr. Javeri mentioned, but in my form was going on walks, journaling, writing things down, having a book. Like right now, I have this book right in front of me. I have all my notes in here. Anytime I'm going through a rough period, I go to my journal, start writing down what's going on. Affirmations help me a lot. Keeping my mind in that positive state and having a particular statement to repeat continuously. Positive music, having mantras, chanting, any kind of positivity, keeping that around me always helps to maintain my emotions. Also incense, nice smells. I always have an incense going up there at the top. So kind of surrounding yourself with that positivity has helped me keep myself in this positive state and not go down that the dark hole. The other thing that helped me was not distracting myself, meaning being focused on the true root cause of the issue, right? Mental health was my issue was deeper than just the mental health. The mental health was how it came out and showed into real life, like the depression. So not being distracted from diving deeper and going to the root cause of my issue. And finally, saying no. I realized that actually saying no would help me give more time to myself, more time for self-care, and diving deeper and understanding what's going on within myself. And so I had to say no a lot to a lot of different people and prevent myself from joining all of these exciting projects and things that are going on. So this is a little bit that I wanted to share about my mental health journey. And I didn't really seek medical attention. I didn't go through the doctor route, but I was happy to find meditation and explore meditation through and through. And that's kind of what took me out of my depression and into better moods and better emotions. So that's my mental health journey. I'm wondering if anyone else in the crowd has something that they'd like to share, maybe a story from their life that they've gone through. Anything would help.
Shall we open up everybody's video, and have on a gallery view and see if anybody wants to talk? So can you take this out, Sneh, the presentation part?
Yeah, I can. Let me security. Okay. Yeah, you should be able to unmute yourselves.
Right. Thank you all for still being here. Truly appreciate it. And this is now an open forum for whatever time we want to keep talking for next 30 minutes, up to next 30 minutes. So if anybody wants to volunteer to ask a question or share, please go ahead.
I just wanted to add, I don't know if you guys know about Dr. or not Dr. but Krishnamurti. He used to JD Krishnamurti. He used to do a lot of talks back in the 70s, 80s, and 90s. He passed away, but he and his talks are still on YouTube. They're quite famous, and he has had talks with like physicists, therapists, psychologists all around, and he has very like precise talks about what the mind is, how it reacts to like the daily struggles and the daily emotions. So if you guys, if anyone wants to uh, if anyone's needs someone, is these type of talks, they can look up Krishnamurti. I can put his name in the chat too. I think he's a Krishnamurti.
Yeah. Anyone wants to share?
So I want to point out some very good books, and I have got some audio books also. Like one is Jailer, and another one is, I'll put the link to the audiobook as well as the PDF. It is also available on Jain library, but like that can reduce your stress drastically. Both of these books, like one book which is like Chess of Karma, is available in English also. Like in this link, you will find in Gujarati and not Chess of Karma, not in Gujarati, but I'll Chess of Karma is in English, and Jailer is in Gujarati as well as English. Both of them are very good stress reliever books. And the audio book is there, which is like Chess of Karma is like a Bollywood stories with good moral. So if anybody watched a movie called Bagban or something, so like somebody, their own son kicked out of his father from the house, and somebody he helped educate in the childhood, he helped and got the father with his home and things like that. So I mean, a lot of good, encouraging, good moral stories in this link which I posted. And earlier, a little bit earlier, I posted somebody, high performing attorney. If she's on medication on schizophrenia, she is a very good attorney. And even if she has schizophrenia, she is a very renowned attorney, capable of functioning in real life.
Cool, thank you. Bye. It seems that we are still all this many people here. So maybe we are all fortunate and lucky that we never had to deal with this situation. Or maybe we, on the other side, we just feel a little shy not to come up and talk, which is both are totally fine. And I hope you are the fortunate one. I'll give you another chance if anybody wants to say something. Otherwise, I'm going to say something. Yes, anybody?
Yeah, hi, this is Jitensha. I'm sorry, I'm on my cell phone listening to this excellent presentation by doctor and the story that the person said. So I have one question. So if you know someone, young, past teenage age, very, intellectually very high on the scale, and you feel that, if person is suffering maybe some mental state, I don't know whether they're not yet diagnosed with any illness, but some state where they don't believe in these kind of things, like the one that helped to this person, I forgot the name, that the meditation, our spiritual background, all the positivity. They just go on Google, research something, and then they go to some groups, and then, they get some information, and then we try to tell, okay, these are the things, has been helping, it's been from generation to generation, people have benefited from those kind of things like meditation, right? Listening to positive music or anything positive, and they just don't believe anything. How do you get those people help or get them on track with these kind of activities to improve either their lifestyle or come out of the state that they are in?
Ronak?
Yeah. I'm going to rephrase the question just to make sure I have it right. Is to how do you help somebody who's not ready to get themselves out of their own circumstance? And you can, if it was that right, Jithan?
Yes, I mean to that, yeah. And the person is, really, really intellectually, very good. They understand, even understand the psychology and all, but they just go off of their own research. They do it on Google, and not willing to listen to anybody. Even if you go to take them to many therapists or psychologists, they won't listen. They'll just do their own research and then go off of that.
Yeah. I find if meeting somebody where they are and who they are is a great starting point. So if this is someone who's highly intellectual and someone who's going to respond to research articles, helping that person get information that they'll respond to, rather than taking them to a therapist, showing them an article that may convince them, maybe I need to go to therapy, so that it's their own decision, rather than it being something you're forcing somebody else to do. But in this individual's case, if they're a very intellectual person, meeting them on that level and giving them something that will help them see what you're trying to do for them.
Okay, thank you.
Mm-hmm.
Actually, I would like to respond with the very young generation person, how she reacted with this book called Jailer, which I posted. So 2018 December, my nephew came here. He proposed his girlfriend and everything, and everything went well. And then his elder sister was upset a little bit, like a lot, because like my younger brother has got engaged and everything went well. I mean, because maybe whatever happened in the past, she said, I'm worried what will happen to how I'll find vegetarian partner, this, that, and everything. And then I gave Jailer book to everybody who was here, like their in-law side and everybody. And then my niece got this Jailer book, and then she went, and she was very upset when we left from here. And later on, she read the book, and as soon as she started reading the book, she felt like peace, basically saying that I will find someone good in my life. Everything happens for some good reason. And before she had she came here when she was in 5th grade from India, and she had an attitude like, I will marry somebody who is raised here in US. If somebody is raised in India, I will not marry that person. After reading the book, her mind opened up a little bit. Somebody who came here for masters, he approached her, and then she said yes, and they are happily married. In their wedding, even my brother said about the book, like that opened up her mind like anything. And she herself also mentioned, because of Jailer, I'm marrying this person. Like a lot of example of book Jailer. Like if you want me to explain a little bit about it, I am ready to do that. And somebody who is not even Jain read the book like 24 different times, same book, and in English and Gujarati and all these different languages. And he says every time he reads the book, he gets some idea, like currently in work, there are situations like this, how I should behave or what should I do. And every time he reads, he gets different ideas. Even if reading the same material, he gets different ideas. And is this example about my niece I told is, I mean, she is like in her 27, 28-year-old right now. And that is a young generation, I would consider. So both the books which I posted are very, very influential, I would say. So there are many more examples. If anybody wants me to tell you in detail, I can go on.
Where is this book available?
I posted the link. I will post here in the chat window again. So it is available in Jaini library also. But here I will post here, tinyurl.com/mygoodread.
Can you post it on Jaina?
No, that I don't have authority to do.
But can you inquire? Because
No, I'll give my email. I'll type my email. You send me email. I will send you the book in the email. So my email is ksangoi@gmail.com. So I will
what's your email?
ksangoi @gmail.com.
Sango?
Sangoi, 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 sangoi @gmail.com.
At gmail.com?
Yeah.
Okay, I will do. Okay, thank you. And the other question is, I think this presentation is from West Coast. How can one encourage the person to join what doctor said? Because we are not on West Coast, we are on Midwest.
That is why, Bipinji, this is Dr. Nitin Shah. We picked, sorry, my name appears as Kinna Gandhi, that's my wife. We picked 2 o'clock time, assuming that it is going to work for all 3 different time zones of North America. And if somebody is not comfortable at this time, I'm not sure what else can we do, but this is like 6 o'clock, right? 6:43 on the East Coast. That shouldn't be too bad to join.
Bipin Bhai, this is Manish.
This is the book, looks like it. This is the jailer book that Kiran Bhai was talking about. This is what it's looked like. It says jailer at the bottom and the name of the author and everything. It's a good book.
Yeah, great. Thank you. Yes, Manish Bhai.
Bipin Bhai, are you from Chicago?
No,
Yes.
Los Angeles.
Chicago.
No, I'm from Los Angeles.
I know you're from Los Angeles, but Bipin Bhai was requesting about the book, right?
Oh, okay. Bipin Bhai, are you from Chicago?
I'm from Chicago. I'm not from Chicago area.
Yeah.
Yeah, Bipin Bhai, I'm also from Chicago. Actually, I'm Sneha's dad. So we have a library in Chicago at Jain Temple, and we got copies of this book.
Oh, do you have the copy of that book?
Yes, so I can give you actually managed library over there. So we have libraries open every other weekend where we have Pathshala a day.
What's your name?
Manish.
Oh, Manish Jain, Manish Shah. Oh, my sister-in-law is a librarian there too. Ketki Vijay Shah.
Bipin Bhai, I know you very well. Naina Ben's husband, right?
Right, right.
તમે આવો ને લાઇબ્રેરીમાં તો તમને હું આપી દઈશ book.
Okay, I'll come and see you.
Yep, we got copies of it. So આ બેને જે બતાવી frame તે એ જ છે exactly અને એની older version એટલે same જ છે બુકો બધી પણ we got I think copies, so I can give you that book.
And it is there in multiple languages: Hindi, Marathi, English, Gujarati, all the languages. And Chess of Karma is available in English in PDF in this link which I sent. I will send it to you. If you send me email, I will send you the PDF also.
Yeah, that link is really good.
તમારો જ અવાજ છે.
Right.
The link works. I think what Kiran uncle sent. It's I think good thing. I just downloaded it. So yeah. Dr. Nitin, is there anything?
No, if anybody has any questions.
Yeah, it's open forum, so if anyone else wants to add anything.
I think that the book about this jailer book, which tells the heart of this, is you have to accept first. Meaning whatever is happening with your life, you just accept it first and then try to think about it. And then there is a deeper connection to it with our Jainism principle of karma. Basically, that's what we must accept first, and then we go about thinking about it. Everything happens for a reason, like someone said on this forum. So the thing about couple of principles that one can basically think about in our daily lives, anger or samta. How can we basically stop for 5 seconds or 10 seconds or 15 seconds before we react to something? So that probably helps, and that constant effort in our lives probably helps this. we have to really be cognizant about it. We have to really remembering every time we basically try to react to something or do something. So if we are aware of this situation, then we can correct it. So I think that book will definitely help.
So basically, jailer is like prison guard, or as many of you know. And so imagine you have done some crime, and judge has given you 3 years prison, say, and judge has said the whatever jailer will hit you whips like 20 whips every day. And if you tell jailer, if you hold jailer's hand or jailer's whip, chabuk jo hota hai, I mean, so if you hold their whip and say, why are you hurting me? I have not done anything wrong to you. And if you hurt me 20 whips, I'm going to hit you back 100 whips or 200 whips back to you. So your jail punishment will increase from 3 years to like 5 years, 10 years, because you obstructed the justice. You did not follow the basically you did not follow the judge's order. So if you happily accept anybody giving you a hard time in your life, if you happily accept it, then it is like you will be let go. If you tell jailer, like, even if you hit 20 whips, 100 whips, 50 whips, I am ready to bear the pain because I have done the crime. So basically your punishment will go down from 3 years to 2 years or 1 year because you have good behavior. So in the same way, imagine there are 2 wells. So one filled with water and another filled with petrol. And if you light a matchstick and put inside both the wells, so the water one would extinguish like nothing has happened, but the petrol one would explode like whole village would burn. So if anybody asks you, why did the explosion happen? Like you can say, because you lighted the matchstick, but that is not the right answer, because that happened in both the wells. So basically, because it was filled with petrol or water. So be like water and make anybody giving you a hard time, be like with them like water and make them happy. So that are the examples from this Abhay Shekhar Suri book.
Very good. I think people will like to read for themselves and get to conclusion. I think simple answer is acceptance. And if you accept your life the way it is, then I think all these things will help, only because I think most of the times we ask more questions about why me, and there is no easy answer. So if you go to karma route, you should be okay. But there is another way and different way to look at it for sure. So no one knows all the right answers. Very good. If there is any other comment, we'll take it. Otherwise, next 5 minutes, Sneh, you can close out. Anybody wants to say anything? We really appreciate everyone hanging around. Good discussion. Thank you for good points that people have brought out. We do intend to have 3 other speakers on next 3 Sundays. Please spread the word. I think especially all the speakers we've tried to bring of the current generation. I'm sorry, I'm putting myself in the past generation, bad. But many of us are reaching there. So, we want to save the world with saving the youth more than us, right? So
Nitin, one quick question. So we can send this link to anyone?
Yes.
Like how many people?
Send it to 10,000 people. Why not, Manish?
Oh, okay. Well, let me see if I can send it to some small groups that we have here.
Please do. It is open. There is no restriction or anything. It's just Jaina's platform, but otherwise it's open to anybody. You don't have to be Jain to join, etc. So, Indian, non-Indians, anybody.
Okay.
Is there a recording available?
The recording, the plan is that after 4 Sundays are over, we will gather the recording of all 4 Sundays and then put it on the website.
Okay. Thank you.
Okay, sure.
Yeah, so this is a very meaningful talk. Thank you again, Jai Jitendra, and thank you everyone for showing up and listening throughout the whole presentation. It really does mean a lot. Our main goal is to raise awareness about various topics, and especially mental health and illness. And what we have all just witnessed and went through during COVID, whether it be with your friends or family, everyone has personal experiences. So these talks are just to bring some light on some topics and then just raise awareness and increase the education among the population. If anyone has closing remarks, like Dr. Nitin.
Yeah, let me give one of my personal philosophy, relatively very simple one, but I will see what Dr. Ronald Trumairi has to say, but I have a simple philosophy of how to stay in balance. And our mind goes up and down for a variety of reasons. So I've come up with this, and I really try to practice it for many, many years. If you are too happy with something, if you are really pleased with something, look at the people who are more fortunate than you. If you are too unhappy with something, look at the people who are less fortunate than you. And guess what? There are plenty of people on both sides of the fence from where you are. And if you have trouble finding those people, give me a call. So, I have developed a habit, Ronak, and I know you will get your chance, but I will tell it now anyway. I have written this for last 20 plus years in all the weddings that I have gone. And I have in the wedding book with my number and email. And I have told them, including your sister Neera, by the way, Ronak, and I have told the bride and groom, I've written something. I'm not going to tell you that. You find from the book and give me a call or email me. Guess what? In 20 years I haven't kept account, lots of weddings, only one couple did reach out and say, yes, we read what you wrote. So the message is, we collect those wedding books. This is, in my opinion, this is so strong and profound that if you really went through it, you can't miss it. And if you read it, I feel you will feel obligated to say something to the person who wrote. Nobody else has come up with yet, but that goes on. Thank you. What do you think, Ronak?
I like it. It's perspective is always invaluable. If you can see a slightly different perspective, it helps you see from your own a little differently.
Yeah, and many times people ask me, aren't you happy? I said, yeah, but I don't have to kind of do a song and dance that I'm happy. Good. And also, bad things happen. So what? It's okay. There are people who have worse things than what I am right now. So
absolutely.
Anyway, thank you.
I like it.
More tips next time.
Absolutely.
Okay, Sneh, that's it. I promise you, I'm not going to say anything anymore.
That's fine.
Thank you all.
Yeah.
Thank you.
Jai Jai bye.
Namaste.
Jai Jinendra. Thank you.
Please spread the word, and we will see you next Sunday.
All right. See ya. Bye.
Thank you. Thank you for a great presentation. Thank you.
Good job, Jaina.
Thank you.